knowledge of essentially most of the important anatomy that's required. So we're going to start to go through most of the anatomy that you're going to need to know. So we'll start off top and work our way very slowly down. So here we have a cut through of a head and a neck. So we have our nasal cavity, we have our mouth cavity, and we've got our tongue, and then at the back we've got the space where the two of them meet, and then in front we've got our windpipe, this rigid tubular structure that you can feel the trachea on yourself if you feel in front and center of your neck, this sort of ribbed tubular structure. And then behind that there's this collapsed food tube called the esophagus, or your gullet. And that's very the very rough anatomy. And why this is particularly important to draw your attention to is that all around here, so all around the back of your mouth, all these structures here in the area we call the oropharynx and the nasopharynx. So this is all just soft tissue. So there's nothing really bony or hard keeping these airways open. So if there's a significant reduction in conscious level, whether that be through trauma, through a medical complication or whatever, then there's the ability for these bits of soft tissue to sort of fall back and collapse in on themselves, and that can sort of begin to obstruct the airway and stop air from passing from the environment down into the lungs, and vice versa. This is also a real problem because we'll talk at a later point about allergic reactions. But when we have a serious allergic reaction, as what we call anaphylaxis, we can get a lot of swelling in the soft tissues in and around the mouth, the nose, and the lips. And when these tissues begin to swell, they just fill up the empty space that's around them. And the empty space that's around them is the airway. So it's this passage from the environment to your lungs. So if you've got really bad swelling, and I'm sure you will have seen pictures of people who've been stung by a bee or have had nasty allergic reactions and their face is all swollen. On the outside, okay, the lips can go out, the lips can protrude outwards, but any swelling on the inside is just going to make this red area smaller and smaller. And that's why, and that's one of the more serious that's one of the mechanisms by which serious allergic reactions end up killing you, because you lose this passage from the environment into your lungs. And again, it will focus it more on the specific discussion around allergic reactions, but reversing that swelling using drugs like adrenaline is a really important tool that we've got in our kit bag. So the nasopharyngeal airways, which if you haven't had a chance to get your hands on yet, you will do as part of your skills, is sort of a long, sort of thin cylindrical structure that passes up through the nose and rides itself and comes and parks itself towards the back here. So it basically passes up through your nasal cavity. The oropharyngeal airway comes and sits nicely round over the tongue and will exit about here, where it then passes out into this big open structure. The reason why you may well have heard talk about why the nasopharyngeal airway or the oropharyngeal airway, the Goodell airway, is less tolerated if you're more awake, is because around here some of the nerves that supply this area are what supply your gag reflex. So the Goodell airway, the oropharyngeal airway, will sit around here and will irritate your gag reflex, which is why it's not tolerated. The nasopharyngeal airway will sneak its way, park itself about here, and will, although it will be uncomfortable, it will not irritate that sort of reaction that you have to just to move it. We then make our way down, and we come down to our trachea, our food pipe, and then we enter the chest cavity. So right at the top, you've got all your main blood vessels. So the aorta, the main blood vessel that goes from your heart to the rest of your body, supplying it with blood, and then all the blue vessels bring blood back from the other parts of your body back to the heart. And you've got these two big air bags either side of it, called your lungs, which obviously inflate and deflate as you breathe, and they transfer oxygen into your blood. And then moving down into the abdomen, just tucked underneath on the right hand side, you've got your liver, and tucked underneath your left hand side, you've got your spleen. Don't know how well it's actually shown on here, but the spleen is tucked in round on the left hand side, with the stomach lying just beneath it, and then lots and lots of bowel lying throughout the rest of the abdomen. And this all, and now people often think that the bottom of the rib cage, if you actually have a feel on your chest at the moment where the bottom of the rib cage, there's often a misconception that that's where your lungs end, and then all the rest of the abdomen is then tucked underneath your lungs into that squishy part that's your tummy. But as you can see here, the liver and the spleen are actually protected. So on this margin here, we can see where all the ribs have been cut off on this diagram. What we can see is that the ribs would come over, and they actually protect these really important organs in the cage. So where you can feel your ribs end and your tummy start, that's really predominantly stomach and bowel. The liver and the spleen are tucked underneath there, and your lungs at the front start a bit higher. Why are these important? These two organs are particularly important because they've got a really, really rich blood supply. So if you have damage to the organs themselves, they can bleed, and they've just got this huge big space of just lots of squish and goo of your bowels and other organs where it can just bleed into, and you can end up bleeding the majority of your circulating blood volume into your abdomen. So that's why the body is nicely evolved to have these protective ribs that cover them up. If you flip the chest the other way around, you can feel your ribs going down at the back, either side. The lungs actually go lower down at the back than at the front. So the liver and the spleen are at the front of the body, and so at the back you've actually got your lungs that come a bit further down to where your ribs kind of end. And just beneath either side you've got your kidneys as well. So your kidneys are at the back of the body, and they I haven't got a picture here for some silly reason. But any trauma to the left or the right of the spine has a risk of injuring your kidneys. They also have a very rich blood supply, and they're a risk of causing blood loss. So just a bit about how it all works. So when you breathe in, the diaphragm, which is this flap here, I'm tracing with my cursor. So this big muscular flap that pulls down, and the chest and the ribs open up outwards, and what that does, that lowers the pressure in these two big wind bags, and it sucks air in from the environment into the mouth down into the lungs. And then when you breathe out, the opposite happens. So the diaphragm relaxes, it pushes upwards, the chest wall closes in, and it compresses the lungs, increasing the pressure in the air in the lungs, and that forces air back out through the mouth. And that's the cycle of what we call ventilation, so moving air from the atmosphere and into the lungs. Any questions on that? Not the most riveting stuff, to be honest, but there we go. A little bit about the nerve supply to the body. So the nerve supply is basically divided up into what we call a central nervous system and then a peripheral nervous system. And the central nervous system basically consists of your brain, and then the motorway of nerves and impulses, which is your spinal cord, and it runs up and down the centre of your spine. And the body is very well adapted, so anything that is important is protected really, really well. So you've got a skull, big bony structure that completely protects the brain, and then you've got the vertebra, which are all the knobbles along your back that you can feel, which have got a ring-like structure which the spinal cord runs down. So everything's very, very well protected from any injury. Obviously, if you have an injury to your spinal cord, one of the mechanisms by which this can happen with trauma is that if you imagine that the spinal cord is this sort of slightly squishy tube of nerves that lie within this sort of cylinder of bone that runs up and down the body. So if you have really significant trauma and it breaks that bone can then move forward and will just shear through the spinal cord, and that's what often will cause the injury. And if you look at this diagram, you can see how. So see all these layers that we've got. So the spinal cord. So the spinal cord runs down the middle where my cursor is, and then you're protecting it with bone at the front, bone at the back, and then it sits in a ring of bone as well. And it's divided up into your cervical spine. So your cervical spine, your thoracic spine, your lumbar spine, and your sacral spine. So cervical spine ends roughly at the level of just above the level of your shoulders. The thoracic spine ends probably just at the just at the top of your buttocks, probably a bit higher actually. The lumbar spine is your what we'd refer to as your lower back, and your sacrum is that bit with that bony prominence that just almost the tip of your spine that you feel if you run your fingers down. And any injury that you get, by and large, there's always exceptions to the rule, but by and large, at the level of injury that you get, it means that all of the nerve supply downstream of that injury will be affected. So if you cut the spinal cord here, in the right hand picture, then all the nerves throughout the rest of the body would be affected and would either cease to function or have significantly reduced function. If you cut it here, then all this would still work, but everything downstream would be affected. And the same if you would cut it here, all of the chest and the arms and the head and the neck would be okay, but everything from the waist downwards would be affected. This is why we make such a big deal about, not only just spinal injury per se, but cervical spine injury is particularly devastating, because the higher up the injury, the more of the body that's affected. And then actually the nerves that supply the muscles involved with breathing, so the diaphragm, which was this muscular organ that we talked about before, they actually come out around what we call C3, C4, so up at this level. So if you have an injury above that level, then you actually cut off the nerve supply to the muscles that supply breathing, so you can't breathe, and therefore as a result you would die. So that's a little bit is the reason why the cervical spine from our perspective is so carefully guarded about. Any questions about that? You're probably all deep in a slumber, and you've already all logged off, and I'm just talking to myself now. But anatomy is never the most interesting topic to be talked about.
I'm finding it interesting, Patrick. Keep going.
Moving on, we've then got another squiggly diagram of more and more tubes and pipes that supply the body with things, and this time we're talking about our circulatory system. So for the exam, you need to remember every single one of these words and descriptions, which I'm sure you've realised is a joke, because I'm not sure I could be bothered trying to learn that either. But essentially, the way the circulatory system works is you've got a main pump in the centre of your chest, which is your heart. The main blood vessels are biggest the closer they are to the heart. The red system pumps blood out from the heart around the whole of the body, and then the blue system drains it back from the faraway part of the body back through a separate system into the other side of the heart, where it then just repeats this cycle of going round and round. So same with the nerves. The higher up the injury, so if you were to looking at where my cursor is, if you were to cut the blood supply here, then that means that you've got a spurting artery that is carrying the blood to all this leg. If you were to cut the blood supply here, you'd still be able to chuck out a fair amount of blood, but the volume of blood that's going to be circulating through that blood vessel compared to that blood vessel is a lot less. And then we come to the discussion about what's difference between the red blood, the arterial blood, or the blue blood, which is the venous blood. And there are some important considerations in terms of mountain rescue, because if you've got a point of bleeding, arterial blood, or the red blood you can see, or the red diagram you can see there, that's a blood that's coming away from the heart and is under really, really, really high pressure. So if you cut the blood vessel, it will be much more difficult to stop the bleeding, and at the time while the bleeding is happening, you're likely to lose a lot more blood. The venous blood that's coming back to the heart is under much, much, much less pressure. So and that sort of bleeding. So I'm sure many of you will have had your bloods taken, a hospital appointment or a doctor's appointment. What you'll find is that unless you're on other types of tablets, the needle will go into the vein, the blood will come out, you'll press on it for maybe 15-20 seconds, and then you'll have a sticky plaster and I'm brave sticker, and that'll be that. Now that's because it's gone into the vein. If you were to do the same procedure, put the same needle into an artery, the same area of the body, it would probably take a couple of minutes for you to be able to press and stop any bleeding from happening. So that's a sort of a very basic description of why there's a difference between venous blood, arterial blood, and what the significance is of having an injury high up in a limb compared to lower down in the limb. So that flows us nicely into a completely different topic of burns. I hope you're liking the sequence of events that we're going through here. Before I move on, any questions on anatomy? We will be covering bones and breaks at a later point, but that's more of a discussion in itself. Any questions about what we've discussed so far?
I've got one, Patrick. So on the acronym with 12 on breathing, we look at laryngeal.
Yeah.
What are we actually looking for on laryngeal?
So it's interesting that you bring this up, because I know that. So are you referring to the 12 flaps?
Yes.
So 12 flaps seems to be being phased out, and I certainly know that on the Llamerist course that they're not strictly asking people to do 12 flaps. If you've learnt 12 flaps, you won't do harm by practicing it if that's what's in your head. But what? So if we go back to this picture of the head and the neck, if you feel on yourself across the front of your neck, you'll feel a quite prominent bony structure called your Adam's apple, which is just sort of underneath your chin, quite high up in your neck, and that bony structure there is your larynx. Now the 12 flaps acronym refers to laryngeal crepitus. So laryngeal means larynx, and crepitus essentially just means sort of crackly. So you can get crepitus elsewhere in the body for a variety of reasons, but it basically means it's crackling. And so if you feel that, and it basically suggests that that bony structure is broken because it's sort of cracking and moving around. It is essentially what it means. It's a very I think they were slightly clutching at straws when they were making the acronym. It doesn't flow very well. But essentially, if you feel that this sort of bony structure up in the neck is all moving around and is broken into bits, then that's essentially what it means.
Thank you very much.
So we'll move on to